Hi, good morning, everyone, and really sorry for the delay. This PowerPoint and technology is quite difficult sometimes. Okay, so in our presentation today, in the training today, we're going to cover the difference between speech, language, and communication. We're going to go through a few therapy techniques that I employ in my sessions. We're going to go through the importance of visuals, because I have a lot of parents that come to me and they don't know how to teach their child, they don't know where to start, and a lot of the time they just use verbal stimulus. So I'm going to be talking to you about how you can use visuals to improve your child's receptive and your child's expressive language skills. The next, we're going to go through how to structure a social story. So when children have certain behaviors or are anxious about certain situations, how you could use a social story to overcome that. Some myth busters, so some common myths that fly around and how false they are, and I'm going to bust those myths today. And some basic do's and don'ts in speech therapy. So there are some mums here that have come to me before who are in therapy with me. So some of the things you would already know in this presentation. Okay, let's get started. So there are a few technical terms that I'm going to explain to you. Hear these terms in your pediatrician or your general practitioner's office or your occupational therapist or speech therapist or physiotherapist. So just explain the difference between speech, language, and communication. So the first one is speech. So speech is defined as sounds and sound combinations that are put together to make words. So for example, in the word cat, you've got the sounds k, a, and t that make the word cat. Okay? There are some structures that help us produce these sounds. So you've got your lips, your teeth, and your tongue. These structures combine together to produce a sound. So in the word cat, the back of your tongue goes up, you produce a k sound, the front of your tongue touches the top of your palate, and you produce the sound t. Okay? So when all these articulators work together, you've got your speech sounds. The next term is language. Language is a little bit more complex, and language takes place in your brain. So processing and expression takes place in your brain. There are structures in your brain called the Wernicke's area and the Broca's area, which deal with the comprehension of language and the expression of language. Okay, so the next definition, and which is the most important definition for speech therapy, is communication. So communication can also be nonverbal. So for example, when someone is angry, they don't have to tell you they're angry. You might see their facial expression, they frown, they fold their hands, they turn away from you, so you know immediately that they're angry. But they're still communicating a message to you. Okay? So communication is two-way. You can't communicate on your own. You need somebody else to communicate with. Just a minute. This mic keeps cutting out into the meaty part of the presentation now that we've gone through all the technical terms. So I want you to take a look at your child's communication building blocks. So the picture of the tree represents your child's communication development. So can anybody tell me, what purpose do the roots of a tree serve? What purpose does the root serve? Can anybody shout it out? Sorry? Yeah, good. They keep the tree grounded. Anything else?
Strong base.
Sorry?
It has a strong base.
Good. It's the base of the tree. It's a foundation. Anything else?
Derives nourishment.
Yeah, great. Okay, so the roots of the tree, they provide the nourishment to the leaves. It helps the tree grow. They transmit the water and the nutrients up to the leaves. So in the same way, your child's communication development, they should have strong roots. Okay? So I want, has Has everybody got their hands out? Can you see the tree on your handout? Okay, on the other side of your handout, there are different aspects of communication. And these different aspects of communication develop at different stages in your child's life. So looking at the tree, I want you to decide what develops first. So what develops at the roots, okay, what develops at the trunk, and what develops last, which is the leaves of the tree. So that can be a little activity for you all at the moment. So just go through all the different aspects. So you've got attention, listening, hearing, babbling, speech sounds, expression. So just have a think and tell me, shout out what you think comes first. What develops at the roots? Good. So what you can do is actually number it from 1 to 11 because there are different aspects over there. There are 11 aspects. Yeah, it is. Okay, so let's have a look and see if you've got them right. So what do we have first develop? So when your baby's born, what is the first thing that develops? Their hearing. Okay, so your baby has to be hearing. So make sure that your child's ears are tested thoroughly. There's no ear infections, there's no wax blocking because that's extremely important. If they're not hearing properly, they're definitely not going to be understanding or expressing correctly. Okay, the next thing is looking. So at this stage, your baby is looking towards the sounds that they hear. They might be looking at your face. So these are very small infants. We've got attention and listening. Okay. Then we've got babbling, pointing, turn taking, comprehension or understanding, single words, using sentences, and last we have speech sounds. Okay, so when your child's roots are firm and when they're grounded and when they're receiving the right nutrients, so that means when you've worked on their attention and listening, then they're grounded enough to learn to grow further in their language development, in their understanding and expression. Okay, so when the roots are grounded, we get them babbling, we get them pointing and turn taking. After they understand what turn taking is about, then we get them understanding. So a child their brains are like sponges, okay? Before your child starts speaking, they are taking in everything around the environment. All the frequently heard words like milk or sleep or bed or shower, they're taking that in first before they express it. So understanding comes first before they express it in single words. Then they start using sentences. So around 2 years of age, your child should be putting 2 words together, okay? And at 3 years, 3 words together, four words together in a sentence. And the last of all is the speech sounds. So a child of about between 5 to 7, they still may be developing their speech sounds. So they may have difficulty saying consonant clusters. For example, train, they might still say tain at around 3 years, which is normal. and around 5, they still may not be able to say the sound, the R sound, which is absolutely normal. So last we have speech sounds. So if you go to a therapist, a speech therapist, and all they work on is speech sounds, stop going there, because they're going to make the development worse. They need to start at the roots. They need to work at attention and listening first before they can. If your child is non-verbal and they start on speech sounds, that's wrong. Okay? So it's extremely important that we understand that your child, you understand how to work on attention and listening, which is going to be a quite large part of this presentation, because I'm assuming that a lot of you have small children, maybe 3 or 4 or 5 years old, who are either non-verbal autism or hard to engage children. And a hard to engage child, if you don't know how to work with them, then you're not going to get, the aspects of pointing, turn taking, and the rest of the leaves of the tree developing. So the research also shows that by around 2 years of age of your child, there's 75% of their brain is developed. So any experience that they have, it actually physically affects the structures of their brain. So you, as their primary caregivers, their parents, your role in their development is extremely important, more than the teachers or their therapists or anybody else. Okay, so just a short definition. So autism is lifelong, and a child if your child is correctly diagnosed with autism, they struggle to interact, they struggle to put their world in order or perceive how things happen in the world. So your job as a parent is to not look for the cure for autism, but to try to understand your child as much as possible. Okay? Think of the help that they need, observe them, what are their sensory difficulties, what level are they at in their language, how do they play, how do they interact with their toys, how do they interact with others. Try to get to know your child as much as possible. Okay, just a few characteristics. So a child on an autistic spectrum, these are very common, you must have seen or heard these before. They love routine. In a very chaotic world, they're able to structure their mind, they're able to structure their day if there is a certain routine that they follow. If there's any change in that routine, you might see extreme behaviors, you might see aggression, you might see extreme anxiety. A lot of them have sensory needs, so they might be hypersensitive or hyposensitive. So they might, if they're hyper, for example, they might hear the sound of a plane before you even see the plane. And they might put their hands over their ears and rock because there are certain sounds that really disturb them. If they're hypo, they might be looking at, trying to feel different textures. They might like certain textures. So that's how you know they're trying to balance their sensory system out. They have very special interests. So they might play with one toy the whole day. And you might see them looking at the wheels of the train, or they might love to see things spin round and round. They derive some sort of comfort from that, from playing with a toy continuously. And the last one is they have difficulty relating to others. So social communication difficulties are marked in a child who has autism. Okay, so now we're going to talk a little bit about the therapy techniques and how speech therapy works.